Good morning. My name is Olivia. I'm known as Olivia K on Facebook, Ollie K on Instagram, and WarmNam9000 on Reddit. I cover nursing related materials mostly, so which will help you with your next attempt for the NCLEX, or you need any nursing help with nursing school. So think of it as I'm your online tutor basically, and stuff that can help you with your Q banks. So I have a playlist for fundamentals, which I might need to update some of the videos a little bit. And then I have a playlist for pharmacology. So there's some pharmacology stuff that's need to know for the NCLEX that's up right now. And this is going to be my last video on the med-surg material that could help you with the NCLEX or through nursing school and ATIs and stuff like that. I have a tease playlist that if you are trying to get into nursing school. I know the videos are old, but I think they can still be helpful to you. So it's up and available. You need to see them. I'm not the one who made the videos, but it helped me while I was trying to get into nursing school. I'm pretty sure it can help you as well. And then I also go over reality TV shows, which I was supposed to cover Ultimatum, I think, this week, but I saw an interesting documentary that I'm going to go over, and that's going to show up for Friday. So I will talk about that one instead. And plus I need to rewatch the Ultimatum, so I'm vying to cover that. So I do have a whole playlist of reality TV show reactions, which I haven't done in a while. I have to go back to my roots. And then I do cover documentaries and stuff, and I have a whole playlist for all of them. So with that said, I am just going to dive into the difference between acute kidney injury and chronic kidney disease, because it is important to differentiate the two. And you can see this on your Q banks like ATI, which I hated so much. Oh my god. But it's very helpful. And then in your Q banks like UWorld, boot camp and whatnot, and you'll also could see this in a case study or a standalone question with the NCLEX. So it's important to go over. So next week I am looking to, like I said, start maternity newborn, because I know I personally had a hard time with newborn and maternity, well, mostly maternity stuff back in nursing school. So I'd like to relearn with you all, and I'm going to cover it again. So it will be helpful, and find any way to help out you all, because maternity newborn is what's the hardest subject for me in nursing school. So with that said, I shall begin with kidneys, right? So kidney is a very important organ in the body, which many people may not realize. Why is it important? Because it helps with filtering the fluids in our body, right? And then it does also help with, especially with pharmacology, where the medication can metabolize, right? So, which is why with certain medications you want to be careful to administer if they have what's called nephrotoxicity, which will have to do with the kidneys, right? It also helps with regulating our blood pressure through, again, with the fluid, right? With filtering the fluid in our bodies and whatnot, and then it helps so that's how it helps with regulating the blood pressure. And then it does also play a role in stimulating red blood cells. So hopefully that helps, and how you guys are able to understand why kidney is very important. So yes, mostly with older people, they may also have their kidneys fail, because when you're aging, some things just fail. But it doesn't happen for every elderly person. Anyone at any age can have kidneys fail for whatever various reasons. So it can fail in very different ways. And it could result into something what's called acute kidney injury or chronic kidney disease, which you will see with patients that need dialysis. Okay? So acute chronic injury, so that's sudden, right? It's like it's on onset, it just happens. It could be because there's some trauma involved, right? But it can be reversible depending on the severity of the injury. So it could be caused by these different factors as well. So dehydration, shock, sepsis, and anybody at any age can have this happen to them, right? And not nephrotoxic medications, which I did just mention a second ago. So meds that can cause some harm to the kidney, so which is why it's important for us to understand the pharmacology and understand what meds should be properly prescribed to a certain patient. Okay, so you will see increase in BUN, creatinine. So when you're seeing BUN and creatinine, just know it has to do with the kidneys, and I believe the normal levels is 8 to 20. So we can also double check, and I know I mentioned that on a lab short recently. Then you'll see what's called obliguria. So that's low levels of urine output. It's really low, like it's not much coming out. So you'll also see metabolic acidosis. We did talk about metabolic acidosis a few videos ago. So so this will be considered like emergency treatment. Like they need to go to the ER like today. Okay. Now, then you have the chronic kidney. So in these cases, this patient will need dialysis or a kidney transplant. So you could see this with some elderlies or people who have kidney compromise, right? So this develops in time. So that's where you have the difference. And plus, if you can look at the names, acute is usually sudden and onset. It's really quick. It just happens, right? Chronic, it happens over time. So this is happening over time with the kidney. Because I had a young patient, dialysis, he became a dialysis patient. So young, around my age too, and it was really sad to see. He's a very sickly guy. He has diabetes and a lot of health issues, blind. So he has done a lot of damage to his kidneys over time because of his past drug use or whatnot. And he wasn't taking good care of himself. And not to mention on top of that, he had juvenile diabetes. So, and you know, with diabetes, it causes a lot of harm to our body and whatnot. It takes a toll. So he, the last time I seen him, which was like a year and a half ago, he was just starting dialysis, which was making me happy because now he could live his life and hopefully he's able to get a kidney transplant because he's still a young guy. And you know, some people I know can do dialysis over time, or they can get a kidney transplant. So we'll see what happens. But it is mostly irreversible, unlike acute I don't know why I keep saying that, acute kidney injury, because that is reversible. In this case, it's irreversible. So this is caused by diabetes, which I was just mentioning about my patient I had a long time ago, my past patient. Hypertension, uncontrolled hypertension. So it's not where it should be. This could be also the result. Again, I mentioned kidney also helps regulate with blood pressure. So then also, you have chronic damage to your body over time. So now, like I mentioned, BUN and creatinine will be elevated, right? The creatinine will be elevated over time. So again, this is over time. This is developing again within months and years in most cases. So you will see what's called uremia. So that's a waste product of your blood, and it happens because the kidney failure is untreated from acute kidney injury rather. So it develops, and then we will eventually see loss of kidney function. So which is where you would need dialysis, as I mentioned. And something I forgot to mention in my dialysis short, when you're doing not peritoneal dialysis rather, but more like the hemodialysis, you want to feel for the bruit, right? So you'll be checking to see if it's functioning, right? It's very important that the fistula is. So you check for the bruit by palpating, and then you're going to listen to the thrill. So you're supposed to hear which sound. So I just wanted to mention that because I know I must have forgotten that on my dialysis short. So there needs strict blood pressure and diabetes control. So that's again, I can just think back to my patient that I had a while ago, and that's what we had to do, check his blood pressure every single visit. no ifs, ands, or buts. And he was always high. It drove me nuts. But we had to control the diabetes, the blood pressure to make sure we're good. Then the doctor will need to prescribe kidney protective medications, adjust the diet, and then, like I said, kidney transplant or dialysis for this patient. So, I hope you guys like the nice music in the background. It's real nice. So the treatment for acute kidney injury would be, we need to monitor eye and O closely. Again, kidney regulates the fluids in our body, right? Avoid nephrotoxic meds, which will be a lot of your antibiotics. And I know there are a couple of them. I can't really think of them on top of it, but I know it's mostly like antibiotics. And then you want to monitor potassium. Why is that? Because the patient can have hyperkalemia or hypo if they're losing the fluid, right? And then what would that result in? Irregular arrhythmias. And we don't want that to happen, right? You know the risk. Then chronic kidney. So they need to be in a low sodium phosphorus diet. That's dialysis, and low potassium rather. So that's mostly with dialysis patients where I had to see to make them write a logbook. I'm like, you need to write down what you're eating. Be careful with the potassiums. I had to stress that out many times. So fluid restriction if ordered. So they're building up a lot of fluid. So in this case, you would be seeing hypotension. I mean, a lot of hypertension, a lot of hyperkalemia. And then dialysis education as needed, right? So they need to not miss any of their appointments. And if they need to reschedule, then they need to reschedule it. And strict blood pressure checks, big time. And especially with diabetes patients, make sure they are within normal blood glucose levels, right? So that's about it for the difference between acute kidney injury and chronic kidney disease. Again, the reason I was going over this series just so that way when you come across Q banks like, again, ATI, UWorld, Boot Camp, Kaplan, or Hearst, you'll have like case studies because they're doing a lot of case studies, and they want to make sure you know the difference between each diagnoses, right? And be able to choose the right answer or the right scenario this patient is likely going over. So that way you're able to pick up on your clinical judgment. Okay, so that's why why I went over this, but this will be my last video. Next week I am going to move on to maternity newborn, so be prepared for that. That's next week. And I'll see you on Wednesday for my surviving nursing school short. All right, and Friday is going to be a special documentary that I'm going to take care of. All right, take care. Have a good one. Bye.